Hello everyone, I'm Dr. Srijitra from Examla Healthcare. Today, I thought I'll talk about a very important topic, dengue fever. Because that is the most reported case in Bangalore today. Every second fever case that is being reported in Bangalore seems to be dengue. So, what is dengue? So, dengue, as you know, is a viral disease and it is spread by Aedes mosquito. This mosquito is very characteristic. We call this mosquito zebra mosquito because it has that characteristic black and white stripes like zebra. And this mosquito comes out in the evening mostly, and cases of dengue and cases of Aedes mosquitoes are quite high, especially during the monsoon period in Bangalore. What are the symptoms associated with dengue? Dengue, we have a pet name, we call it breakbone disease because that peculiar joint pains are quite characteristic with the dengue cases. So the joint pain, body aches, high fever, headache, stomach upset, nausea, vomiting. So these are the symptoms that are associated with dengue. But currently in Bangalore, what I am noticing is more than the joint pains, more than the fever itself, I think the exhaustion rate are quite high associated with dengue because the exhaustion seems to be lasting for quite some days. So even in the recovered patient, this exhaustion seems to be lasting for quite some days. So not just the exhaustion, there is a peculiar itching, rashes of the skin all over the body are being reported along with the dengue cases in Bangalore today. So now let me try to answer a few questions that are associated with dengue. Is it contagious? No, it is not as contagious like any other viral diseases because unlike any other viral diseases, it is spread only through the bite of mosquitoes, especially the female Aedes mosquito. And it is not usually, the virus is not usually spread through body discharges, be it saliva, be it the mucus or be it the breast milk. It is not spread like that. It is only spread through the bite of mosquitoes. So the person to person spread is quite less when it comes to dengue. And there is absolutely no problem in feeding the child because the mother is positive with dengue. There is absolutely no problem if the mother has to feed the child because there is no recorded cases of spreading of dengue through breast milk. So it is quite safe to feed your baby. So definitely it is not as contagious like any other viral diseases. So the second question being, is it fatal? Of course, the severity of the disease is quite high when it comes to the dengue. Like any other viral diseases, definitely the WBC count or leukopenia can happen, or the WBC count can come down below 5,000, and thrombocytopenia is quite marked with the dengue fever. Thrombocytopenia being the platelets count can drastically drop down, especially in dengue cases. In dengue cases, the drop of platelets levels are quite drastic and dramatic because I have seen cases wherein the platelets can drop anywhere from 25,000 to 30,000 per day. So within a few days, the patient can go down to a very critical condition if the platelets drop into certain levels. So when the platelets drop below certain level, there are always chances for internal bleeding. We can bleed into the stomach. There will be sudden stomach pain and stomach tenderness. You can bleed through your gums. You can spit or vomit blood. You can bleed into your skin. We call it petechiae. You will see that kind of a bruised feeling under your skin. So that is a very severe or very critical condition. This is the stage wherein you'll have to resort to platelet transfusion to save your life. The third question being, does the dengue infection gives you any lifetime immunity or any long-term immunity? So definitely yes. If you are once infected with dengue, then definitely there are chances that you can have a long-term immunity in your body. But also you have to understand that there are a lot of strains of dengue. There are a lot of strains of different types of dengue present in our environment. So if you are infected with one strain, definitely you will be protected against that strain for quite some time. But there are also chances that the second strain or the third strain can infect you. Usually it says that when you are first infected with dengue and the second infection or the third infection if you are getting, the severity and the fatality can be a bit high. So you'll have to be very cautious out there. So make sure that you keep all the mosquito repellent, do everything that you can to keep the mosquito away from you and from your house. Now let us look into the treatment methods that are available in treating dengue. So whether it is allopathy or homeopathy, most of the treatment that we give is usually supportive treatment. We give medications according to the symptoms. So we have medications to bring down the fever, to bring down the body pains, to bring up the appetite, to bring down the exhaustions. So all the medications that are available are usually supportive treatments. The best medication that is available for dengue is usually we say it has rest and lot of fluids. So make sure that you take a lot of fluids and take enough rest because that is the best way wherein we can recover very fast. So along with the supportive medication, homeopathy have certain medications to bring up your platelets level. So this I say it with absolute responsibility and absolute certainty. We have medications to bring up your platelets level. Not within a week or month, but within a day. Within 24 hours, we have medications to bring up your platelets level. So if anyone out there who is suffering from dengue and if they have a very low platelets level, you please contact us. It doesn't matter that you have to come to the clinic or not. We will be able to courier you the medications. We will be able to denso the medications. We have medications to bring up your platelets within a day. So I say this with absolute responsibility. So saying that, I also want to add that there are preventive medications available in homeopathy to prevent dengue cases. So this is a season wherein the dengue cases are quite at the high rise. So you please approach any homeopathic doctors. They will give you the preventive medications for dengue. So take this regularly every month to protect yourself and your family from dengue cases. So saying that, I would like to wind up this section. You please stay happy and fit. And if you really like the video, you please make sure to like, comment and subscribe. And also, please don't forget to share it among your friends. Thank you so much.